Breast MRI is a specialized technique that we use in breast imaging where we use magnetic resonance imaging and inject contrast into the veins. It allows us to take advantage of blood flow that is seen in breast cancers, allows us to subtract out the background noise that we might otherwise see on a mammogram and detect cancers a little bit earlier. It's important to note there are two different types of breast MRI. We have a standard breast MRI and we have a fast breast MRI. The fast breast MRI is also known as an abbreviated breast MRI. Women who have the standard complete breast MRI should be getting it on an annual basis if they have an increased risk of developing breast cancer. So there are a couple criteria to consider when we're talking about who should have a full standard breast MRI. We have risk calculators that help determine a patient's or a woman's increased risk for developing breast cancer, and it's called a Tyrer-Cuzick calculation. It's a model that we use to determine your risk. Women that have increased risk above 20% should be getting a standard breast MRI every year. Women who have had a diagnosis of breast cancer before the age of 50 or have a diagnosis of breast cancer but have extremely dense breast tissue or heterogeneously dense breast tissue on their mammogram, they should be having a standard breast MRI each year. And women with genetic mutations that increase their risk for developing breast cancer should also have a standard breast MRI. Then we have the women that should be getting abbreviated or fast breast MRIs. These women don't have increased risk for developing breast cancer based on our risk calculator, family history, or personal history of breast cancer. These women have dense tissue. So there are two main categories, non-dense and dense. Women who have dense tissue have the opportunity to receive supplemental fast breast MRIs in addition to their annual mammograms. And with the supplemental fast breast MRIs, we're able to detect cancers that might not be visible on mammogram because there are definitely cancers not visible on mammogram. And fast MRI is really good at detecting this.